Hi everyone, welcome to the Jobskin webinar. Today we'll be talking about ZIPS. With us today is Veronica Eichmann, our clinical representative from New Zealand, as well as Rosemary Kendall, our clinical representative in Australia. My name is Adam Ho, I'm the Managing Director, but with that, I will kick off and hand it over to Rosemary.
Hi everyone, thanks for joining us. I'm actually a bit excited about this particular webinar topic. It seems like a slightly odd one just to talk about ZIPS, but I think Veronica and I would both say this is one of those topics that we get lots of questions about. It's not so much that there's confusion, but just people are unsure about the best way to go. So hopefully we'll be able to answer those questions for you today. So what we're going to work our way through, the list of like little mini topics is the value, or maybe not, of ZIPS, the impact on the construction of a garment, talk about how you decide where to put a zip, also consider whether a zip always has to go to the end of a garment, talk a bit about linings, then discuss whether you have a tab or not a tab, and what that looks like and why you choose. Briefly consider whether the size matters when you're making decisions about a zip, and then touch on the sort of garment features that make it easier to do up a zip. So first of all, the value or not of zips. So a few questions here. Does every garment need a zip? The answer is unquestionably no. And does a zip make donning easier? Well, this is the million-dollar question. And I think if we don't really stop and think about a zip in a pressure garment specifically, most people think, oh, they have a hard time putting on their socks, their arm sleeve, their whatever. I'll put in a zip to make it easier. And sometimes that is correct. A zip does make donning easier, but not always. So if it doesn't, why doesn't it? I think if you think about when you put on a pair of jeans, the thought of pulling up a pair of jeans, assuming they're not stretch jeans, the thought of pulling them up and getting them on without a zip is, well, it's completely improbable, because you need to be able to open the jeans wide enough to get over your hips, and then you zip them up. But a garment, a pressure garment, they're not like clothes, and it's because the tension of the garment, that's the problem. So you find, and you'll probably hear patients say to you, you know, I need 3 hands, because you need a hand on each side of the garment to hold the zip together. So you need a 3rd hand to get the zip up. So I did once have, I was sort of tackled by a patient's sister who I suggested that maybe not putting a zip in might make it easier, because she'd always requested zips, and the patient's sister got extremely angry with me at the suggestion and just wouldn't listen to it. But I could see with this particular patient that actually if the zip was taken away, the garments would be so much easier for her if she was taught how to put them on and off properly. So let's think about, you know, we don't want to just put in zips willy-nilly, obviously, because it does have to make donning easier, but we also need to be mindful about how that can potentially impact a garment. And I think this is something that it's, you know, it's not uncommon for therapists not to understand that it does actually, it can affect the effectiveness of a garment. So we do know, and some of you may have heard the presentation by Lisa McIntyre at the Burns conference, the virtual Burns conference last year, that Jobskin hosted Lisa McIntyre's presentation, because she's a textile scientist in Scotland, and she's written quite a few papers. If you have never read any of her papers, they're very interesting, because she has done a significant amount of research into fabrics that are used for medical compression garments specifically. And she asserts, and has got evidence to support this, that the more seams there are in a garment, the less reliable the compression, and therefore the weaker the garment. And we need to consider that a zip has the same effect as an additional seam. Be mindful, the other way that a garment's construction is impacted is that there needs to be linings under the zip. That doesn't in and of itself cause a problem, but just be mindful that that is so. And now this is a really important thing to consider. So zips can also reduce the level of compression in specific areas if they buckle. Now this is not to do with the quality of the zip. It is potentially to do with the length of the zip and also where the zip is sited and whether the zip is curved in any way. For example, sometimes if you are needing to put a zip in a sock into the foot, you want to avoid the malleoli, and so you might curve the zip behind, say, the lateral malleolus to bring it down onto the dorsum of the foot. But that curvature does affect the way the zip is going to sit for obvious reasons, and therefore it can buckle. Also on torsos, for say in a vest, for a long zip, you might find that there is buckling. And so it is worth considering whether the zip is actually required. I did have a colleague actually who is wearing a zip, wearing a vest, compression vest presently for some surgery. She said to me, you know, could I, you know, my zip is buckling. Is there anything I can do about it? And I said, put the vest, see if you can put the vest on without a zip. Because if you can, without undoing the zip, I should say, because if you can, you don't need the zip. Now, for some people's movement and proportion, that's never going to be a possibility, but a surprising number of people can manage a vest, for example, without a zip. And she put the vest on without a zip and perfectly fine. So she's had that zip removed and it's made for a more comfortable fit. So now how do you decide where the zip goes? Well, ideally use an existing seam, because then you're not adding a additional seam into the garment, just as we were talking about on the last slide. Obviously consider the tissue underneath, so you want to avoid pressure points, bony prominences, and you want to protect underlying skin. For example, if you have a particularly friable area of skin, don't take the zip there. Or like avoiding the malleolus is a good example. You might want to site a zip just slightly behind a malleolus rather than over the top. And then also consider the patient's reach and convenience, because there's no point, for example, putting a zip into right down to the dorsum of the foot if somebody can't reach the base of the zip. There are ways that we can modify it a bit, but you definitely need to consider that. Now, a couple of comments specifically about zips in gloves, because I think a lot of people, when they order a custom cut and sew glove, just routinely put in a zip because I think it's going to be a bit hard to put on. They don't always need a zip. And in fact, I would assert that more often than not, probably considerably more often than not, gloves can be worn, donned and doffed quite readily without a zip. What you do need to consider is the ratio of the size of the circumference of the MCP, or if perhaps the dorsum of the hand, if that's the fattest point of the hand, to the wrist. Because if you have a very large hand and a very small wrist, it's too hard to stretch the wrist circumference, the wrist elastic over that large MCP circumference. I would love it if I could give you a ratio and say if the ratio is this to this, then you have to put a zip in, but it's not that precise a science, and part of that is because it's not just the ratio of the MCP circumference to the wrist, it's also how big the wrist is in the first place. Because a very tiny hand, there's not a lot of stretch to be had, whereas in a very large hand, large wrist, there is more stretch to be had. So it's not a simple numerical ratio. But if you are a little bit concerned, do ask the designers, and just you can write the comment on the order form saying, do you think the patient can get this on without a zip? So if you do need to put a zip in, where are you going to put it? Most commonly, if you ask for a zip in the in a glove, it will go on the dorsum of the hand, but you can choose to put it on the radial side, or even the ulnar side, or even the radial side. But obviously you are making those decisions based on the specific clinical needs of your patient. Maybe you're trying to avoid grafts, maybe you're trying to get optimal compression. But probably the one other thing I would say is just bear in mind that the highest pressure points in the hand are the radial and ulnar borders. In previous webinars, we spoke about where the compression is designed on a cylinder. And when you flatten the cylinder, which of course the cross section of a hand is very much a flattened oval, you target the compression at the sort of the pointy out bits. In the case of the cross section of a hand, that is the sides of the hand. So you might want to think about that when you're considering putting a zip there. Now, does a zip always have to go to the end? I think our kind of go-to as therapists is, if we're going to put a zip in, we treat it sort of like a pair of jeans and say, oh, well, you know, I want the zip to go down, say, from the top of the sock to just above the lateral malleolus, for example. Or in a vest, we probably routinely just do a full zip like a wind cheater. But actually, frequently, I would say, you're better off not going all the way. So in the case of a sock, you might consider putting the zip between those two arrowheads there so that it's stitched, it's fabric all the way around at the top of the garment, and that makes it quite nice and stable. But by having that zip in the midsection of the sock, you've relieved that pressure to help get the garment on, because it's usually not the say the circumference at the top of the garment that's a problem. It's usually the circumference around the ankle that's the issue. In a vest, it pretty much, if you do have a vest in there, you pretty much need to go to the top. But do you have to go all the way to the bottom? Think about that with donning and doffing, because sometimes it's easier, particularly in a back vest, if you're not having to hold the base of the zip together to get the zip started. If you can put a vest on and have that fabric for the bottom, I don't know, 10, 15 centimetres, and then zip from there up, that's another thing to consider, and it can be very helpful to some people. And then in the case of the arm sleeve, similarly to the sock, you could take the pressure off getting that garment up by just putting a short zip, say from the upper arm to the elbow, or from the upper arm to the wrist if need be. If you were to do that, you certainly have to consider donning aids, and particularly in an arm, because generally when people are putting on an arm sleeve, they've only got one spare hand. They're not using two hands. Okay, so I did say we'd talk about linings, and just so that you know what's available, a standard lining, like you can see on the back of that face mask there, is just folded over satin lining that's stitched underneath. So it doesn't add bulk to the garment, and it just means that the teeth of the zip are not coming into contact with the skin, not causing any potential pressure points. There is an option for hair protection lining, which we would normally use on a face mask rather than any other garment. But if you had a particularly hairy person and the hair was catching in the zip, we can do the same thing. It's basically the satin, rather than being folded over and stitched to one side, is a wider piece of satin, single only, and stitched to both sides of the zip. And then unfortunately I didn't have a photo of this, but the padded zip lining looks like the standard lining, apart from the fact that you have got a thin layer of foam in between that folded over piece of standard satin lining. And if you do need a bit of padding or additional protection, that's an option that you can use. So now the question, to tab or not to tab? So what do I mean by that actually? The tab is that kind of fold over at the top of a zip. Now, you can see on those vests there is a fold over on both of those. And what I would say is this, in my opinion, and you may not agree with me, but I think that is the sort of the one aspect of, say, a cut and sew garment that makes it look like a medical compression garment. You look at that one in the middle that has been designed to almost look like activewear. And what makes it look like it's not a normal garment? It's that fold over at the top. Why do we have that zip there? We do that to stop children pulling down zips and garments, you know, because, or trying to take their garments off. Adults, we generally trust to not do that without having to have the zip tab there, but it also serves as a little extra protection and a little bit of support to ensure that the zip doesn't slide down at all. The zips, I have to say, are generally very reliable. I don't think it's really necessary for that, but you may choose to use it for sort of some protection. An alternative is the way the tab is on the sock, which can you see that the zip in this particular garment only goes up to the base of the elastic, and then the tab is actually a sideways tab rather than a fold over one. So that's actually quite a good option for socks if you just might need to tweak the pressure a little bit, and also for necks in vests. If you have a high neck, like a turtleneck in the vest, the zip coming straight up, whether front or back, can sort of feel a little bit choky on the turtleneck and a little bit rigid. So you can finish the zip at the, say, the sternal notch or at C7 at the back, and then the turtleneck can have a sideways Velcro tab, which is actually it's an excellent option in my opinion. So when we're talking to tab or not to tab, you can see this garment here has no tab, and this is a high-necked lymph crop vest designed specifically for breast edema, but you can see that looks, apart from the height of it, it really looks like a garment, not specifically a pressure garment. But we've also been working on an alternative, which we put our heads together in the middle of the year, and we are introducing another option, which is a triangle tab, which so this is kind of like almost halfway between the two. It doesn't look as medical as the fold over tab. It's an extension of the satin lining that's brought over the top and stitched down, so it covers the actual little zipper tab, but it's not bulky. It's sufficient to stop children fiddling with their zip. So if you do need a little bit of protection, that's kind of a nice, soft, easier option. I apologise about the quality of the photo, but I had to take that photo on my kitchen bench, and not quite the same as the professional photos, but it's at least it will show you. And that just shows you what it looks like when the zip is a little bit undone. But the initial response we've had from therapists is actually it looks great. It looks more like a design choice than a medical addition. Okay, now big question, haha. Does size matter? This can I just ask you not to screenshot or take a photo of this, because we have consent from this lovely man with who has abdominal edema plus supermorbid obesity, but he was very generous in allowing me to use this image. But he is wearing a torso band to support this abdominal edema, and I'm not sure how clearly you can see because unfortunately the garment is black, but he has got a zip down the centre, which he needed to sort of help get that torso band up and over his large belly. And the two sort of horizontal strips are large Velcro tabs. So just because that particular zip is under a significant amount of strain. And we did try a few alternatives for this particular gentleman, but this large Velcro tab has been really effective in holding the zip together, supporting the belly, supporting the garment so that he can do that up. So does size matter? Yes, it does matter. But that doesn't mean, oh, large sizes, we can't do that or we can't use a zip, because there are ways and means. And just finally, what are the options for making it easier to do up a zip so that a patient doesn't need a third hand? This garment, which we've seen in various slides today, has got the lot. Okay, it's got the zip tab at the top, which we've spoken about, and then those two little tabs down the length of the zip are zip fastening aids. So you basically, you can use your hand to pull the two sides of the zip together, and then you just secure that little Velcro tab and then pull the zip up to that Velcro tab, then secure the next one, undo that one, pull the zip all the way up. So they act as the third hand, really, because they hold it together while you use the zip. If you have someone where reach is an issue, then you can put a zip looper on. We generally make it out of a sort of a leather string, and the person can hold the zip looper if they can't reach all the way down, and then pull the zip up. You can see that the zip looper there has then just been neatly tucked away under the zip fastening tab so that it's not a tripping hazard or not an annoyance or getting in the way. And then, of course, remember the other option for making it easier to do up a zip is don't go all the way to the top, so that you don't have to hold the two sides of the garment together at the top of the garment too. Okay, that's what we were going to cover today. Same prescription and ordering. That's all familiar information to you, I know, but we always mention this in our webinars. I would encourage you to go and look at Jobskin.com, because there is, well, an ever-increasing range of resources under the support and training tab, measuring videos, measuring tips and tricks, lit reviews, resources, references to the YouTube channel. We've got that all there, and also the YouTube Jobskin ANZ is getting increasingly large bank of webinars so that you can look up specific topics. And as always, Veronica and I are here to help, probably most reliably caught on email, and the designers also can be reached, and designers@jobskin.com or on the factory phone number, and they're very happy to talk through construction challenges or whether something is physically possible. And we've probably got a couple of minutes for questions if anything has come up during the webinar. If so, just either unmute or just pop something in the chat box. Everyone that I can see is smiling, so I hope that means no, I don't think I've got any questions. But if you do, you're welcome to email Veronica and I, or the designers, of course, and we will, well, hopefully we'll answer your questions. Thank you for joining us today.
Thank you,
Thank
Rosemary.
you.